Everyone who is sexually active should be aware of sexually transmitted infections and the risk of getting them, but it's especially important for women whether you have sex with a man or woman.
Women disproportionately bear the long-term consequences of STIs. But why are women so severely affected? The lining of the vagina is thinner and more delicate than the skin on the penis, so it's easier for bacteria and viruses to penetrate. Also, the vagina is moist, which makes it a good environment for bacteria to grow.
If symptoms do occur, they can go away even though the infection remains.
Women often have a normal discharge or think the burning, itching is related to a yeast infection. Men usually notice symptoms like discharge because it's unusual.
Genital ulcers from herpes or syphilis can occur in the vagina and may not be easily visible.
Untreated STIs can lead to pelvic inflammatory disease, which can cause infertility and ectopic pregnancy.
Genital herpes, syphilis, and HIV can be passed on to babies during pregnancy and at delivery. This can cause low birth weight, blindness, brain damage, deafness, or it can cause your baby to be stillborn.
While HPV is also common in men, it rarely causes serious health problems for them.
How do I know if I'm at risk?
Good question. Just ask yourself, have you had anal, oral, or vaginal sex without a condom?
Do you have multiple partners?
Have you shared needles?
Do you exchange sex for drugs or money?
Do you have a partner that answers yes to any of these questions, or whose health status you don't know? If you said yes to any of these questions, then you're at risk for getting or passing on an STI.
Every year there are 20 million new cases of STIs, so what can you do to protect yourself?
Using a male or female condom every time you have sex is one of the best ways to reduce the risk of getting many STIs, including HIV.
There are vaccines for Hep B and HPV. Get them.
Don't share needles, or better yet, just don't do drugs.
Get yourself tested. Don't assume that STI testing is part of your annual Pap exam. While it screens for cervical cancer, it is not a good test for STIs.
Stick with one partner or abstain from sex. And remember, washing your genitals, urinating, or douching will not prevent STIs.
Class is over, guys. Remember to practice safe sex.
And get yourself tested.
Bye.
Bye.
Created using Powtoon.